This podcast is brought to you by Podcast Nation.
You are listening to As a Woman, episode 129, Lifestyle and Fertility with Dr. Ashley Eskew.
Welcome to As a Woman, the podcast hosted by fertility physician Dr. Natalie Crawford to educate and empower women. Each week, learn about your health, your fertility, and how they relate to your true self. Become a part of the community fostering collaboration over competition while learning how to authentically find your voice and amplify others as a woman.
Hi, friends. Welcome back to the As a Woman podcast. I am so excited to have you here today and to listen to somebody who I adore, Dr. Ashley Eskew, talk about fertility and lifestyle. Dr. Eskew received her undergrad from Furman University in Greenville, South Carolina. She got her MD from the University of Louisville in Kentucky and did residency in OBGYN at Atrium Health in Charlotte, North Carolina. She then completed her reproductive endocrinology and infertility training at WashU in St. Louis, where she concurrently obtained a Master of Science in Clinical Investigation. She is double board certified in OBGYN and REI, and her research interests for a long time have included the impact of dietary and lifestyle factors on fertility and outcomes of IVF. She's also the co-founder of OvulifeMD, a digital education company providing women and men with evidence-based approaches to optimizing lifestyle factors that influence fertility. You are going to love hearing everything she has to say. Ashley, I'm so excited to have you on the As a Woman podcast. Thank you so much for joining me.
So excited to be here.
Well, I have just been a fan of yours for the longest time, and I know we've been able to connect and become more close recently, which I'm thrilled about. But I want to make sure everybody in the audience really gets to know you and what brought you on this journey. So let's just start out by, how'd you go into medicine? Like, did you always want to be a doctor, or what was your pathway to this point?
Yeah, that's a great question. So I had an interest in medicine and in women's health specifically, actually starting in high school. Both of my parents were physicians. My dad was a family doctor. So he got to take care, and like the family doctor who took care of like all the things, right? So I got to hear a lot about that, but ultimately had some health struggles of my own in my teens that got me more interested in medicine in the first place, and specifically women's health, because I found like I couldn't see anybody like me in medicine necessarily. And so I wanted to be a part of that and a part of that change. And ultimately, went to med school, and then really kind of dumb luck ended up in an AI acting intern rotation on REI. I actually wanted to do one in Gyn-Onc, and they didn't have any spots where I wanted to go. So
look at that. Worked out perfectly, right?
I know. So I ended up doing it in REI and just had a blast. And it was so interesting to see everything from the, Müllerian anomalies and pediatric adolescent to infertility and kind of beyond too. So that's what initially piqued my interest in it. And then really, the rest is history, I guess.
I know. Well, tell me about your journey to REI specifically, because I know from my own experience, it's so hard to match into this field, and it poses a lot of opportunity for imposter syndrome and doubt, and that idea of being confident in yourself that you are smart enough, good enough to match into such a competitive field. What was your experience like making that decision from OBGYN, which is already a really hard residency and a hard time to make this choice, into saying, hey, I'm going to go for this really competitive fellowship?
Yeah, it's kind of interesting because when I was in med school, after I told my parents I wanted to do OBGYN, they're like, no, you don't. No, you don't. We're going to sit you down with all of our OB friends, and they're going to tell you why you shouldn't do it. And I'm like, I think at this point, I realized I didn't choose it. It chose me, and at that point, you really just can't turn away from something either. So ultimately did do the path of OBGYN, which was really intimidating for a lot of reasons. You have to be confident to be able to do a lot of the things and make snap decisions, which are so important in such a timely fashion on labor and delivery and that sort of thing. But came back to REI, I actually, when I went into residency, didn't get to do REI again until my third year. And so get really lost in the shuffle of all the other things you're learning in OBGYN residency. I couldn't fathom doing more training after that, honestly. But when I came back around it to my third year and just being on that rotation, I was like, this is what I have to do with my life. This is absolutely what I have to do. And there was just no turning back from there. So I had to bust a move and hustle because I decided late, like you said. And like, I just, everybody everybody, my mentors where I did residency were so supportive and were like, we will do anything we can to help you. But I mean, it's a ton of work, right? You got to do all the research, you got to do all the things. And everybody else was like, it's not going to happen. You decided too late. I didn't go to a residency that had fellowships in it either. I went to more of like a hybrid program, which people told me that would be, hold me back ultimately. And all I can say is that if you want something hard enough and you put your mind to it, you can get it. And there's no one right way to go about it either. So ultimately was able to work towards that and then ended up at WashU for a fellowship, which was a wonderful experience. So
well, it's kind of like a dagger in my side because I was at UNC when we interviewed you. And I remember we wanted you there so badly. So you talk about this like, oh, maybe I wouldn't match. And I was like, this girl is a rock star. I became like your number one fan. And just from the get-go, because sometimes you just see somebody, and I think you said it really well, like this is just what they're meant to do. And they're doing all the things to prove how committed they are to the pathway. And that was you 100%. So
thank you for
guess I'll
that.
forgive you for going to WashU. No, they have a fabulous
I did love
fellowship.
UNC. Yes. I needed to get out of North Carolina for a little while, which is, as you know, is where I am now in Charlotte. So yeah. But the path, I mean, I wouldn't change anything about it. It was without a doubt one of the hardest things I've ever done, but helped me grow in both, personally and then also just confidence, right? I mean, you mentioned that too. And I think so much of it just makes you like the imposter syndrome is real, but you earned your seat at the table and, sit at it and be there. So, yeah.
It is nice to see different practice styles of different places and different regions because things are done a certain way or by people who are trained by the same people. And it's nice to see different styles to figure out what your own style is and what your own interests are. And I'm sure it was at WashU, or maybe one of the things that attracted you there, because I really loved that program too, is their huge emphasis on lifestyle factors and how they impact fertility. And that's something that I'm passionate about and you are too. But is that part of the reason that you went there, or did that spark your interest while you were there? Tell me about that.
Yeah, it was. So, part of the interview process, for those of you who don't know, you learn a lot about what, for REI specifically, you have to do 18 months of research. So you learn a lot about what a program like their research background is, and you have to do it. Ideally, you do it in something that you're interested in. So it's not a miserable year and a half. So they had so many opportunities for, in Kelly Molly's lab, they did a lot of the dietary stuff and impacts on fertility. Dr. Emily Youngheim, she was super interested in that area, and it just really clicked for me. And so I knew I was interested in that before from my own personal health journey. And so that kind of carried into that. And that's, then I just found this dearth of evidence that that supports all of the lifestyle dietary changes for fertility and fertility related outcomes. And that's kind of what took me down that path.
I'm sure you and I are similar on this, that there's so much evidence when you start putting your toe into the water of the studies that are out there on diet and fertility and lifestyle factors. It's something that's hard to study. So I think it's hard to draw huge, big conclusions, but there have been so many studies and all pointing into the same direction that I do find it so interesting that it's something that's just now gaining momentum to talk about. And that's the importance of lifestyle factors on fertility. And I know there's some REIs who still don't even talk about it. They're like, oh, whatever you want to do, that's fine. Whereas it's a huge part of my counseling and how I address with patients, controlling what they can't control and optimizing the environment. But were you surprised by that at first too, how different people practice with this lifestyle side of our field?
I mean, I think people sometimes think, that we overemphasize it, right? Or, that it's woo-woo or whatever, however you want to say it. But there is so much evidence, and it's hard to do randomized control trials on this. Like, I get that, but there's so much evidence pointing to the importance of it. And then seeing it in your patients too, right? Like seeing the before and after, and then the actual tangible outcomes that can make such a difference speaks volumes. And you can't, an N of one and is an N of one, but I do think that there is a lot to be said about that. And just the last patient that I saw today, actually, she said that she came for a second opinion, and the last physician that she saw, who she did a couple of rounds of IVF with, she brought up nutrition, and their comment was, I don't believe in that stuff, so I feel like there's still so much of that that's prevalent in our field. And, one of my biggest missions is to combat misinformation, because there's a lot of that. And there's so many different wormholes that patients can go down with Dr. Google to say, hey, do this or do that, and torture themselves with it. Right.
Oh, preach. Yes.
That's kind of one of my biggest passions, is to combat that misinformation too.
So let's start to fight a little bit of that. So if I was a patient who was trying to get pregnant or wanting to optimize my fertility, and I asked you about lifestyle factors, hey, does my diet matter? What about exercise or toxins? What is some general advice that's good for everybody, regardless of disease state?
Yeah. So general advice, I kind of think about it in a couple of different kind of buckets, if you will. So diet, nutrition, environmental toxins, and then the mind body component, which I tend to put exercise in there too, because of just the vast mental benefits there. So in terms of diet, one of the things that I think so many women obsess over is quantity over quality, right? And like, well, if I just only eat 1,000 calories a day, it's not going to matter necessarily what I eat. But then you're not thinking about
like you're starving yourself. Please
you're
stop.
starving yourself. Yes. And that's not sustainable. The first message is this is a lifestyle. It's not a short-term fix. It's something that I want you to be able to sustain through pregnancy, through postpartum, for your next pregnancy and beyond. So in terms of breaking down just simple dietary things, really looking at, we mentioned the quality of food. So carbohydrates, one of the easiest things is to swap out the quality of carbohydrate that you're eating. So study after study has pointed to eating more low glycemic load carbohydrates, or foods that don't spike your blood sugar and your insulin as much, which creates this just inflammatory pathway. So much of what we talk about is linked back to decreasing inflammation and, really kind of lessening that burden in the body. And so eating lower glycemic load carbohydrates, whole grains that are already rich in natural phytonutrients and antioxidants. So swapping out, white rice for brown rice, doing quinoa or, other types of grains that are not so fast digesting is a very quick thing. And so what I'll usually say is or I'll bring up in the office is like Google index glycemic load, and then look at the images and just choose foods from like the green column and do less from the yellow columns, and then avoid foods in the red column. And that's like a very easy place to start in terms of carbohydrates, but don't restrict. Like you don't need to go low carb. You don't need to do keto. You don't need to do all of these things.
There's so much bad information, I'm interrupting you, on carbohydrates out there. And I say the exact same things, like good whole grain carbs. They've got lots of good fiber. They're very good for you. But people get really fearful of what society has done in diet culture, as far as like carbs are the enemy. Carbs make you gain weight. You need to be keto. You need to be gluten-free. And I really feel like the fertility community, in an attempt to control things that they can't control, has jumped on some of these diet trends online and really made it confusing for patients. Don't you see that?
Oh my goodness, all the time. And then the gluten-free thing too. So it needs to be carb-free, gluten-free. And I think for patients who are gluten sensitive, have celiacs, then definitely, either going gluten-free or, knowing what, listening to your body, number one, and like how you feel after you eat in a certain way. But yes, so the low carb, the gluten-free, that soy is the enemy, these are some of like the biggest myths out there, I feel like too. And so in terms of protein, I think that's a good segue into protein too, talking about soy, plant-based proteins, like data would support increasing intake of plant-based proteins in terms of decreasing ovulatory infertility, improving implantation rates, even improving like endometrial thickness in some studies too, because of the lignans in the plant-based proteins. I mean, all of that is, you don't have to be a vegetarian. And that's where I think it's all about balance and saying it's a lifestyle. But if you swap out even 1 to 2 meals a day for more plant-based proteins, as opposed to eating just chicken and turkey and all the lean white meats, which, I mean, I used to be the boiled chicken girl, like, okay, well, it's like the lowest carb, the highest protein, tastes like sweat. Ugh. But, like now I definitely am more of a plant eater.
I love it. That's exactly what I tell patients. I mean, a lot of patients, I think, are intimidated to talk diet. I'm plant-based. And so they just are assuming I'm going to tell them don't eat meat ever, ever. And I say, look, data supports the more plants, the better. So if you look at, I eat 3 meals a day, pick 1 meal to have a meat serving in it and pick the other 2 to force yourself to use plant-based protein sources. And automatically you're getting a more diverse array of nutrients. It's better for you based on all of these studies. And so I say exactly the same thing. It's not all or nothing. It's actually each little tick that you make in the favor of better for your body is going to be good for your eggs, your uterus, your embryos, all of the things.
And then same, I kind of approach them like, all right, plants, the best, right? If you can take that. And then seafood sources of protein are also excellent. So, there's some great studies out there about couples who even eat a couple servings of salmon a week, that's really naturally rich in, anti-inflammatory omega-3s and a shorter time to pregnancy, less intake of the high mercury, speaking of environmental toxins, that sort of stuff, type fish, like tuna, limiting that to maybe one time a week, but, plants and then seafood, and then kind of bringing in, if you can, eat like the high quality type meats that are grass-fed, organic, free range. And I think one of the limiting factors, and I'd be interested to hear what you think about this too, on data on meat intake specifically and fertility related outcomes, is that we don't really have any studies that control for high quality versus low quality meats. You know what I mean? Like there are differing levels of pesticides in that, all of that.
I told a patient this today, is that the problem is that some studies group all meats together. So you have like really poor quality meat with excellent quality. And then other studies will have, all red meat, but they're not quantifying for what. So we have to, I'm going to take it with a grain of salt, but we have to kind of put it in context. It does look like, should you be having, beef in general for every meal? No. But if you're going to, choosing high quality sources for when you have it makes sense. And
right.
I always say, just because we don't have a study proving something doesn't mean that it doesn't exist. Some things are really tough to study. And we both know it can take a lot to get funding for research, to do nutrition-based population cohort studies. You need a ton of people, you need a lot of money, a good research team. And so some of these factors are hard to evaluate. So the meat studies in general are very diverse, and for how they categorize meat and seafood and red meat all together. Are they separated out? And there's nothing that's looking at your, say, high quality meats versus other ones. And so I think that's just interesting as a consumer, when you're absorbing that information, trying to help patients understand the limitations of it and just make better choices when they make them.
Right. Absolutely. And I think there's ways to, one of the biggest challenges I feel like is also involving the partner in this conversation. And a lot of times men love their meat, but you can find ways to mix it in and maybe do like half lentils, half ground beef or something like that too, for some of those. But in general, I say, red meat sparingly as well, just because most data would support that with the more types of inflammatory fats that are found in that as well. But carbohydrates, looking at the high quality whole grains. And then in terms of proteins, looking more plant-based proteins, seafood sources of proteins, and even things like tempeh tofu that have soy in them. Also, I feel like that gets a bad rap too, and are fine in moderation, and data would actually support eating that over other sources of protein too.
I say almost the exact same spiel when I give my lifestyle handout and talk to patients about lifestyle. It's like high in fruits and vegetables, healthy fats, high quality meats, but not meat at every meal, emphasize plant-based protein sources, whole grains, limit processed foods, refined, carbohydrates and sugars. And so it's really, and I tell everybody something, is that none of this is like going to be a news flash to you, right? This is essentially what people are saying over and over again is a healthy diet. And studies are supporting not just for your eggs or your uterus, but for your heart, for your brain, for longevity, for cancer prevention. And so all studies are kind of rowing in the same direction as far as the things that you eat impact the disease state of your body. And we both know infertility is a disease.
Right. Absolutely. I couldn't agree more. And I think that it's, it's not a one size fits all approach, and it's not something that you have to like totally overhaul overnight. I mean, it's like making one choice every day, and that's going to add up to something much bigger over the long haul too. And so I think that's super important to remember.
I love that. So after diet, what's your kind of next focus when you talk about lifestyle?
Yeah. So in terms of beyond diet, looking at things, I usually talk about supplements with diet too. I feel like so much misinformation about supplements out there, but taking a good prenatal with folic acid in it, that sort of thing. If you're vitamin D deficient, supplementing that. If you are a vegetarian, making sure your B12, you have that checked and are supplementing that appropriately if needed. But then looking at environmental toxins, I mean, they're in and all around us, right? I, generally talk about the things that are your highest contact points, because I think none of us can live in a bubble, right? But what are the things that, you touch or drink or consume every single day that could impact your fertility too? So one of the things I talk about most frequently is BPA exposure, bisphenol A exposure, which has been linked with infertility and miscarriage, is found in a lot of the hard plastics. It's used as a plasticizer, and, swapping out your plastic water bottles for stainless steel water bottles, your hot coffee cup I drank out of a plastic coffee cup for, 5 years.
Same. I mean, yuck.
And didn't think about it.
Think about all the like disposable water, which sometimes that's your best choice, but like they sit in a hot truck being transported places like in plastics. And my mind is just blown at how much plastic we've been exposed to over, the course of our life. For us 80s babies, it's pretty bad.
It is so bad. And like the cellophane wrapped meals that you like microwave, like the convenience meals that were in like in med school.
What about Easy Mac? Do you remember that stuff? Did you do it in college? Okay. Sorry. Gross.
Yeah, so bad. So that, and then, the microwave meals are so convenient. And then so it's decreasing exposure to that as much as possible. So reheating your foods in glass instead of plastic, taking your, stuff that has more acid in it. If you have like a tomato-based juice or something, and putting that in glass instead of plastic, even if you're not reheating it, what you drink out of. And then, simple things like the thermal covering on thermal receipts has BPA in it. So the great news is that there's a short half-life with this stuff. So if you make changes today, it's going to improve things in a pretty short order. So by decreasing your exposure today, it could help, very, very, very soon. So I think that that's important to remember. And then pesticide residues. There's so much data on pesticide residues now in the Earth study. And I thought that was pretty fascinating, that higher intake of, high pesticide residue produce was associated with a number of negative outcomes related to fertility. So really buying organic when you can. And if that's not, feasible budget-wise, then looking at, produce that has a lower pesticide residue burden, making sure that you're washing those fruits and vegetables really, really well too.
Okay, a few things to say here because this is so fascinating to me. So one is that I didn't ever give toxins much thought. And then in fellowship at UNC, I was involved in a research project looking at the time to conceive, which is a natural fertility data population. And we ran PFCs, or perfluorinated chemical levels, on everybody. And diving into that research, I was just shocked how that's like in Teflon and all these places, and all the negative health impacts that exist, and that people just don't talk about. I mean, we cooked on Teflon 100% of the time. And then like in BPA, thinking about, like you said, thermal receipts. I mean, like airline tickets when they used to be printed out, like can liners for like canned goods. I mean, oh my gosh, that's mind blowing. And then I recorded a YouTube recently on environmental toxins in the preconception and pregnancy. And it's the most boring video ever because there's so many things. And I think the reality is we've become so accustomed to living in a world with toxins. Sometimes we don't even think about these things, that the things we eat, we put on our body, that we're exposed to really can have negative health outcomes for both us, our fertility, and if we're pregnant, for our pregnancy, and that we need to be paying attention to some of these factors. But it's really takes active, processing, changing out food, even if you get to go food, putting it in a different container, like you said, not putting plastics in the dishwasher or the microwave, changing over your dishes, looking at your products when it comes to phthalates and things like that. It really is very, very interesting how much data is out there about just health impacts when it comes to a lot of these toxins. And even though there's not a perfect human study on egg quality, because human eggs are so hard to study, we have to take them out of the body. That's called IVF. That's like a very tough study to do. You look at some of the mouse-based studies on egg quality and ovarian reserve when it comes to exposure to these chemicals. And it's eye-opening as far as perhaps why we're seeing, increased rates of DOR, more infertility, some of these factors in, younger women now that we weren't at least reporting or checking or talking about in earlier years. Don't you? I mean, what are your thoughts on that?
Yeah, no, I completely agree. And I think the data on infertility is coming up more and more. But what about that preconception group of women who haven't tried to conceive, who aren't infertile? Like, what are the impacts on them? We got to do, I was part of a study, like helped out with a study at WashU called the Lifestyle and Ovarian Reserve Study. And it looked at women of reproductive age without a history of infertility and looked at markers of ovarian reserve and all these different lifestyle factors. And so we divided it up and looked at the pro-fertility diet too, specifically, which is all the dietary things that we talked about, but also takes into account the pesticide residue burden and increased intake of lower pesticide residue scores. And in women with overweight or obese BMIs, it actually higher adherence to that type of diet was associated with a higher ovarian reserve as well. So I think there's so much that we don't know at this point in terms of the impacts of like us taking that in at the age of 16, or, our entire lives, really. I mean, I didn't really change over any of my lifestyle until fellowship, honestly, was a lot of it, because it was a lack of information and education. And I think that that's really challenging to overcome. But I hear you. And I completely agree that there's so many things that are in and around us that we have to pick the things, not to be overwhelmed, but to pick the things that are realistic for us to change. And like one thing at a time, like I said. And I also think it's helpful to start room by room, right? So your kitchen,
that's a great idea.
A lot. Yeah. Then you're going to say, okay, here are my pots and pans. Like you can't change them all over at one time. That's a really expensive endeavor. And, just choosing one, go stainless steel, even the ones that are ceramic coated now have other types of
chemicals in them.
Yeah. So you just have to have a very discerning eye and do your research and invest wisely. And those things will last a lifetime too,
I love that advice to go room by room. And I also love the sentiment of you don't have to change everything at once. This is not all or nothing. So you go get rid of the plastic coffee cup and now you have a new one, and just start somewhere by making little changes. And I think people got a little bit better when COVID happened about like washing their food and because when nobody knew how COVID was spread, everybody was cleaning things better. But really that pesticide residue and then the toxins, in our food. And I think we have to really think about the containers that our foods come in and these packaged foods, like you said, the processed foods and their packaging. It's really different to have like broccoli that you've cleaned well versus something that's been processed and put in a package. There's just a different level of exposure. So making the same good choices can really go hand in hand, and they all can cumulatively add up to being really beneficial.
Definitely. And then you mentioned personal care products too. I read a shocking, alarming statistic recently that the average woman puts over 200 chemicals on her body before she leaves the house. Before she leaves the house.
Oh
yes. Stop. Yeah. So I think same thing there is just going, okay, hair products, lotion, things that you use on a, daily basis, and starting there. And I love Skin Deep Database. I use that to kind of look at like safety ratings on products. There's other ways to kind of look about, how safe a product that you use is, but also looking for phthalate free, paraben free, all these things that are endocrine disrupting chemicals when the endocrine system is so critically vital for reproductive processes, right? So I think that part is really important as well.
I love it. And what about mind body? I think we both think stress and exercise and a lot of these things are important. We both know that stress impacts how your brain sends out hormones, how your body interprets things. How do you advise people when it comes to this mind-body relationship with fertility?
Yeah. So I think one of the first things is that data has shown that couples who go through infertility have stress levels comparable to those who have been given a cancer diagnosis. And I think that that's one of the things that is most often discounted by women and couples going through the fertility journey, because they're so focused on the next test, the next thing, the next intervention, that you forget about yourself in the process sometimes, and taking care of you, which is arguably the most important thing in this process. And so, I talk to couples about there's so many different types of interventions that have been shown to be helpful, from, a regular yoga practice while going through fertility treatments to even just simple meditations as well, which have been shown to significantly decrease anxiety and depression scores and improve quality of life. And if you can do that while going through such a stressful process, then why not give it a try? And there's so many, I think one of few good things came out of COVID, but one of the excellent things is that there's so many great online options for yoga now, different type of mindfulness, apps that you can use too, which is super helpful. Acupuncture. There's a lot of mixed data on acupuncture and its impact on pregnancy rates. So I don't really, encourage it for that purpose, but for the purposes of improving anxiety, depression scores again, and improving quality of life, it has been shown to do that consistently. And that part is so important throughout the process. And even once you're, pregnant and kind of on that journey, because that's a whole different journey too.
I completely agree. And I think the thing here, and all studies show that if you can decrease stress or lessen anxiety, that it's going to be beneficial for you when it comes to treatment or outcomes. However, everybody's really different, and what may stress one person out may be stress relieving for the next person. And so question I get asked most is about acupuncture. And so what I always tell people is the needles aren't magic. What is beneficial is taking that time and the space on you and not being to your phone or answering work emails and in a quiet Zen place. And if you're claustrophobic and being on your face makes you feel really overwhelmed or panicky, you're not going to get the benefit because
Or if
the
you don't like
benefit,
needles.
or you don't like needles, right? The benefit
Yeah.
is to kind of have that drop in cortisol, that like release stressful feeling. And we have to figure out, how do you get there for you? Because we're all wired a little bit differently. We all have things that make us better and worse. And I always give off the rattling thing. Is it acupuncture? Is it therapy? Is it exercise? Is it yoga? Is it meditation? What is the thing that you can do for you? Because this is a hard time and it's not going to get easier. Often I think people have this idea that the moment you get pregnant, it'll be easier. And the reality is a whole new level of anxiety sets in. So having those stress coping mechanisms is really, really important and can be beneficial along this entire process.
Definitely. Yeah, I would echo that. And I think that that's a really good point to drive home, is that every single person is different and you can't compare your journey to anybody else's, and what worked for one woman may not work for another. And I think that's a lot of the misinformation too, is that, well, this worked for me, so everybody should do this. And that's a really hard fight to fight. And I think that's so important to kind of tune into yourself, listen to your body, listen to your needs, and stay focused on that as well.
I think that's really important to restate. So even though you just said, I'm gonna restate it again. Everybody's really different. And online groups and forums and measures of support, like I love the Instagram fertility community.
Absolutely.
But you have to make sure that it is serving you in a good way, because when you start getting to the zone where you're not taking from it the support, yet you're comparing yourself and you're feeling like you're not adding up, or you're having jealousy, those are really normal, natural emotions, but maybe that isn't a good, healthy behavior for you at that time. And so stepping away, whether it's from real life friends, family, colleagues, saying, hey, I need to take some time to myself or be with these other people, like this is too stressful, or even online groups, like that's okay. You're allowed to ask for help, do something different. You don't have to go to the baby showers. You're allowed to kind of excuse yourself from some of those stressful moments. And I think sometimes people need to hear that it's okay to prioritize themselves. Women especially are so bad at that. And we give so much of ourselves to pleasing others that, your body, your health really can take a hit. And I think, that's really what some of the stress is coming down to, is not having good counter mechanisms, because we're just burning the candle at both ends.
Right.
Okay, pivot for me, because you've got a little entrepreneurship spirit when it comes to lifestyle, fertility, and, the importance of trying to break down some of this misinformation. So people who don't know, why don't you kind of dive into, your other endeavors outside of clinical medicine?
Yeah. So outside of clinical medicine, I'm also co-founder of OvulifeMD, which is a digital education company that really combines all of my greatest passions, which is a lot of the stuff that we've talked about. So really kind of helping women identify an evidence-based approach to optimizing the lifestyle factors that impact fertility and reproductive outcomes. And so, we have all sorts of different resources and that focus on kind of those three main tenets. So nutrition, diet, supplementation, environmental toxins, and the mind-body component, and really kind of having a community of support through that. And then also the how-to. I think that some of the hardest things is sometimes you can have the information and then not know how to execute, or what next, or how to take the next step. And so, the goal was to really just kind of be a source of evidence-based information for that, where people could come and get those questions answered, and then also have a community of support around them while doing it.
I love it. That's fabulous. And I just applaud you, because that's a rather big undertaking to say, I'm going to kind of compile all of this and become the evidence-based source for it. Has it been overwhelming or easy, or what's your experience been kind of growing this?
A little bit of both. Yeah. I mean, it's so fun, right? I mean, nobody teaches you how to do this sort of stuff in medicine, right? We're totally down one path, and it's exercising a completely different part of my brain, which I love and reinvigorates me in a different way than medicine and patient-facing care does too. I mean, you get to impact so many more women on such a bigger, just have a lot more access in that regard. And that part is just so humbling and gratifying. And, I'm co-founder with my husband, who actually we met in residency. So he was family medicine resident and then did an integrative medicine fellowship. And, his side of things really incorporates a lot of the diet, lifestyle, nutrition, and honestly helped me so much on my own personal health journey that it just didn't need to be that complicated, right? And it didn't need to be that hard to find, good information that people could actually point to some evidence for. And so that's where it was kind of born out of that passion to help make that accessible to a much larger group of women and couples going through fertility treatment.
I love it. Bless you for doing it with your spouse, because that is woohoo. That's a whole nother level. But I just, even somebody who had infertility, I was an OBGYN resident and then an REI fellow at the same time. And I felt like I was finding out this information on my own as an educated professional in the field. I was looking up studies and starting to compile it. So I feel like even to really highly educated / professional people in the field, sometimes this is not an easy thing or not something that everybody's really taught, depending on who your mentors are and what their interests were. So I really applaud you for taking this on. And I think it's going to grow and grow to be such a powerful tool for everybody who's not only just trying to conceive, but trying to take charge of their health overall and their reproductive health. So fabulous job. Ashley, I could talk to you all day long, but I would love it if you would just tell the people, where they can find you on your social handles and how they can follow you so they can keep up with everything you're doing.
Yes. Yeah. So I'm most active on @OvulifeMD for Instagram, Facebook, Pinterest. You can find us on there. Our website's OvulifeMD.com. My personal Instagram handle, which I'm less active on these days because you'll see me on Ovulife more. I realized something had to give, is @AshleyEskewMD as well. So it has been so fun chatting with you and just super excited to be here.
I love it. Well, I'm going to have you back on so we can do a special episode on PCOS and specific recommendations for PCOS. Because I think everybody always asks about that, and that will be fun for us to do together. So thank you so much.
Yes. Thank you.
Thank you all so much for listening. I hope you learned a lot. As always, you can follow along on Instagram @NatalieCrawfordMD or check out the YouTube channel, Natalie Crawford MD. Thanks, friends.
My name is Len Webb.
And I'm Vincent Williams.
We'd like to welcome you to our documentary podcast, The Class of 1989. Over the course of 6 episodes, Vincent and I will examine the importance of 6 Black films that came out in '89 and how they shaped and influenced popular culture, filmmaking, and society in general.
Come on, sucker. Let's get it on.
New episodes will begin running weekly on March 6th.